Hi, my name is Jeannie Gu. I'm a family and community resource worker for the MFCSNS office, and today we're going to talk about the effects of COVID-19 on parents, adults, and elders. Some of the issues are health and mental issues, limited access to services such as going to the doctors or to the hospital, restrictions on public outing or family gatherings such as birthday parties, baby showers, and etc. Financial hardships, loss of employment, cannot pay bills, food, safety, security. Grief and bereavement issues, such as wakes, church service, and solid days. We are not gathering as we used to for wakes and solid days. Unreported domestic violence, anxiety, depression, and overwhelm. More people are feeling overwhelmed since the pandemic. More addictions to alcohol, drugs, and online gambling. Effects of COVID-19 on teenagers and youth. Isolation. Friends and families are not visiting each other as they used to. Education. Classroom versus virtual. Anxiety. Fears of catching COVID. Depression. Feeling hopeless. Relationships between pairs, boyfriend and girlfriends. Addiction. Alcohol and drug misuse. Food safety. Breakfast program. Sports activities are limited. These are some of the effects of COVID-19 on families.
My name is Julia Gale. I'm a family and community resource person for the MFCSNS office. Today we are going to be talking about how can families support each other during the COVID-19. We could support them by spiritually, emotionally, mentally, and physical. The first one that we've decided would be emotionally. We're going to be talking about the emotional part. Staying connected to friends, family, and pets. It is important to stay with your family and friends, and also with your pets. Keeping a journal and a diary for your activities, daily activities. Weekly accomplishments. Having a calendar, writing down your homework, and doing daily chores. Maintaining good thoughts, being creative, thinking good thoughts, and outside the box. You could have your outside activities and being creative. The next one would be the physical part, which is active life, staying as an active lifestyle, going for your walks with your family, your friends, or your animals. Doing family outings, which is going out for a drive or going out to having an out takeouts or seasonal activities, which is like spring, summer, fall, and winter. And when it's seasonal, then you could go in the summer, you go swimming, go camping. Winter, you go coasting, skating. There's so many things you could do during your seasonal and what you could wear. Having an eat when you're healthy eating, which is really important. Exchanging recipes. You can even do that online, exchanging recipes, or even on Facebook or YouTube. Household chores is very important too, having turns of doing chores. Power naps is really important to people. Then you will feel more energized. Doing the spiritual part of it. Now prayers are really important, and smudging. Being respectful to others. Learning more about your culture with the Mi'kmaq teaching stories, reading to your children, telling stories about your past. Giving thanks to the Creator and God. Attending church services. Now I know it's limited, but attending them is really good. And also, if you like to do a sweat lodge, you attend sweat lodge services as family. Now, in the mental part of it, we do our daily routines like everybody else does their daily routines. Meditations, some people do yoga, they listen to soft music, they have their resting periods. Take social media breaks. Now, sometimes it's good to go for a cruise, go for Tim Hortons, or, like taking a break from your job and whatever you're doing that's social. You take your social media breaks with them. Be creative. Draw, do crafts, do games with your families. And even get some movies and have popcorn night. Also, it's very important to get proper rest and nutrition. Practice me time. When we say me time, it's your time to go, even go by yourself. If the stores are unlimited, like go to a certain store that you can go and shop and buy stuff from internet, or me time, bingo time. It's also great to just practice. So these four, being emotionally, physically, spiritual, and mentally, is a great use for families that support each other during the COVID-19.
Hello, my name is Norman Silverboy. I'm Family and Community Support Worker for Eskasoni. Today I'm here to talk to you about the safety guidelines of the COVID-19 guidelines. Wear a mask. Indoor public areas. Social distance 6 feet or 2 meters. Hand washing. Sanitizer. No traveling. Essential travel only. Stay within family bubble. Call 811 if you have COVID-19 symptoms or possible exposures. Testing novel coronavirus. Mental health and well-being. Crisis helpline numbers 1-888-429-8167. For mental health and addiction, 1-855-922-1122. Kids helpline, 1-800-668-6868. Good to Talk, Nova Scotia, 1-833-292-3698. And this for university and college students. Thank you for viewing our video.